Hello, my name's Paul Clegg and I have a special interest in antioxidant health. There's a correlation between free radical damage to the cells and DNA of our body and the way that antioxidants suppress that damage. Left unchecked, there's a belief amongst the scientific and the medical profession that damaged DNA and damaged cells through free radical activity can lead to all sorts of challenges. And of course the government and governments across Europe and America are all advising the public to increase the level of antioxidants they're getting by fruits, vegetables, nuts, oils and seeds, and we hear about 5 a day, and in some parts of Europe that's nearer 12 a day, and these arguments as to what is the right level. However, merely taking 2, 3, 4, 5 portions a day is not necessarily the answer. I think it's giving people a false sense of security, because we've got to consider where the food comes from, how many miles it's travelled, how it's prepared, whether the nutritional and antioxidant value is cooked out of it, what's the quality of the food, etc. And there's other factors that will influence antioxidant status. There's only one way to really know, and I call it a health check, is to be able to measure antioxidant status in the cells of the body, and you can do that non-invasively within 90 seconds. Now, in the hands of a wellness professional, a chiropractor, an ophthalmic practitioner, a dental professional, this is very powerful information indeed. And the reason is, if you can scientifically measure in one moment in time and then advise on a lifestyle or nutritional regime that the patient can undertake, and you can measure maybe a month or 2 months or 3 months after and see how that lifestyle and dietary change and nutritional change has affected antioxidant status, then you really can change lives. Because if antioxidants are the answer, the higher the level we get in order to protect ourselves, the longer we're likely to live free of disease. Now, I'm the first to say there's other factors involved, so I'm not saying that this is a cure-all, but guessing somebody's antioxidant protection just by listening to what foods they say they eat is not a professional answer. If you'd like to know more about how you can incorporate this science into your own lifestyle, or you can incorporate this science into your practice and help your patients and deliver a far better level of advice backed up with science, then please complete your details on this particular page and I'll send you information. And if the information is something that you feel you'd like to know more about, and you want to know ways in which we might work together, I'd be delighted to talk to you further. Thanks very much for listening.